Noticing signs and symptoms. 2013 was a strange year for me. I was in my 8th year as an ICU nurse and a hospital supervisor too. I worked a ton of overtime, usually working 5 to 7 days a week, picking up shifts on all the different floors of the medium-sized hospitals where I was employed. This included med-surg, ortho, rehab, ER, and a lot on the psychiatric floor. It seemed like a natural fit for me with my peer counseling background and love of people. It gave me the ability to meet people and become friends with most of the nurses, CNAs, respiratory therapists, and the rest of the hospital staff. I loved it. I loved talking and getting to know everyone, and it helped a lot when I would have to call and beg one of them to come in and work on days where we were short-staffed, which happens all the time at the hospital. I remember one nurse that I had to call in one night. Let's just call him Justin. He was a quality nurse, not long out of nursing school, maybe a year or two, but solid and always eager to learn as long as it wasn't too far of a stretch beyond his current skills. He had taken some of the easier ICU patients on previous days, yet was mostly a telemetry nurse that had upgraded in his skills from his original med-surg floor. We had a patient come in through the ER with respiratory distress, probably pneumonia. I had tried many other nurses and avoided calling Justin because I knew that he had just started a long stretch of days off. I did not want to bug him. I finally made the call as a last resort and told him about the patient that he would be taking care of if he was willing to come in. He said cool, as long as it wasn't a ventilated patient. I was stoked, since the patient was only on BiPAP and not a ventilator. He said that he would be at the hospital in a few minutes. By the time I walked back into the ER to cheerfully declare to all that I was an amazing hospital supervisor and had found someone to take care of the patient, the ER doc had already intubated the patient. Great, I thought. I had to call Justin back and ask him if he would still be willing to come in, even though this patient was ventilated. He was hesitant at first, but since I was his friend and promised him that I would walk him through how to care for a ventilated patient, and that I would set him up with other nurses to help him in case of an emergency, he agreed to still come in. As I was showing him how to care for a ventilated patient, we talked some about life and how things were going for the two of us. I complained about some of the small things in my life, and he complained about his ex-wife and how he was getting very limited visitation time with his kids. He was aware that this was partially due to his drinking getting worse. I assured him that he would be okay, and that it was probably just due to his increased stress that he was going through. He agreed, and we joked around a little bit with our dark ICU sense of humor. I checked in on him through the night a few times, not simply to see how the patient was doing, but also to let him know that I cared about him. He seemed a little off. At the end of the shift, before giving a report to the house supervisor that was coming on shift, I stopped by the ICU one last time to thank him. I gave him a meal voucher, a hug, and told him that I was very thankful for him to be on a professional level, and that I loved him as a person. He teared up, said thanks, and told me that he loved me too. He told me that he really needed the talk and the encouragement that I had given him. I smiled and patted him on the shoulder and told him that I had faith that he would pull through everything. A few days later, I got bad news. He had been dating one of the CNAs, a nurse assistant, that worked at our hospital for the previous few months. They apparently had been drinking a little bit to let off some steam. He grabbed a gun, made a not funny joke to his girlfriend, and ended his life right in front of her. There was some question as to whether he did it on purpose or not. However, we later learned how truly distraught he had been. He had shown some of the key signs and symptoms that I had picked up on. Signs that had drawn me to talk to him and later tell him that I loved him and had faith in him. Signs like his increased alcohol intake, depression over isolation from his kids. Even his smiling and joking were likely a cover-up to the rest of the world of how lost, sad, and hopeless he felt. Although I don't blame myself, although I don't feel guilty now, I do wish that something different would have happened and that he was still with us. I'm so glad that I got to tell him that I loved him that one last time I saw him. Seeking out and being aware of some of the signs and symptoms of possible self-harm or suicide are some of the greatest tools that we can use to help someone that is in pain and contemplating ending their life. Some of the signs are found by keying in on words that someone says. Others can be noted by watching their behavior. Knowing the following signs is the first step to helping yourself or others. Know that some of these may come on slowly and subtle. Knowing the following signs is the first step to helping yourself or others. Know that some of these may come on slowly as subtle signs that grow in severity and notability over time. Severe sadness or moodiness. Long-lasting sadness, mood swings, including unexpected rage. All of these are seen regularly for days, weeks, or months prior to suicide or suicide attempt. These are usually due to the hopelessness that has come over them. All of us have a natural desire to have what we truly value at the core of who we are. When that is not present in our lives, or we feel that it is impossible to have, that is where most of the despair and hopelessness come from. It is through finding a way in which we do actually have, or a way to obtain what we truly value, that we find meaning in our lives, and therefore joy, happiness, and fulfillment. Difficulty with sleep. Either difficulty falling asleep, difficulty staying asleep, or both. These are usually due to the mind constantly running, thinking through every option and thinking of everything that we see wrong in our lives. Withdrawal. Purposely deciding to be alone and avoid family, friends, or social activities is a common sign of depression that can lead a person to taking their own life. This is most notable when someone decides to stop doing activities that they used to enjoy and always be excited about. Be aware of someone that is isolating themselves from others when they previously haven't been is a huge sign of potential future suicide attempt. Changes in personality and appearance. A person that is considering harming themselves or even taking their own life might suddenly change their personality. Someone that was outgoing may become antisocial. Someone that was kind might become aggressive. But also look out for unexpected changes in behaviors, such as a person that was previously aggressive suddenly becoming timid. Notice their body language. Are they slumping their shoulders forward and inward, looking down more, a sign of looking into themselves and the negative moments of the past and present? Are they speaking slower or with a much softer voice, demonstrating a lack of confidence? Are they exhibiting body language signs that indicate self-comforting? If you are interested in understanding body language, to notice these or many more signs, we get into this a lot more detail in some of our training programs. If you love people as I do, join our newsletter at www.staystrongbook.com. We'd love to help you help others. In addition, many times the person considering suicide might become less and less worried about their personal hygiene or personal appearance. Self-harm or risk-taking behavior. Sometimes risky behaviors are noticed, such as the increase of drugs and alcohol, reckless driving, daredevil actions, and even engaging in unsafe sexual acts. All of these are potential signs that might show that the person no longer values their life. Recent trauma or crisis. Some major traumas, such as the death of a loved one, a recent diagnosis of a major illness, loss of a job, or serious financial problems, relationship breakup, or divorce have all been seen to increase the risk of someone taking their own life. In addition, sometimes finally dealing with the healing process from trauma experienced years before can be just as stressful as it was at the time of the trauma happened. Making preparations. Often seen in the late stages of one's preparations to commit suicide, many will take steps towards putting their personal business in order. This often involves giving away valued personal belongings, writing a will, making visits or phone calls to family and friends that they may not have had contact with for a long time. making restitution with those they feel that they may have harmed or offended, purchasing equipment that could be used in their own death, such as a firearm, rope, knife, razor blades, or drugs or poison. A more subtle sign could be the person cleaning or organizing their room, home, or yard where they might not have before, increasing the risk of suicide or harm. Different studies state that anywhere between 50 to 75% of people contemplating ending their life will give family members or a friend a warning sign of their intentions by talking more about suicide. This might not be an outright statement like, "I'm going to kill myself," but something vaguer like, "Maybe it would be better if I was not even alive," or "I wish I could just go to bed and never wake up again." Although not everyone who makes threats of suicide will follow through with it, every threat of suicide should be taken seriously and investigated further. Uncharacteristic happiness or calmness. Also seen as one of the last signs of impending suicide, a person that has been depressed, sad, or clearly suicidal might suddenly appear oddly happy or calm. This is usually due to the anticipation of relief from the difficulties of life that they believe will be resolved through their taking their own life. It's almost like a relief from the difficulties and confusion that they are facing in life. When this sign is noted, it would be a good idea to become more vigilant in their actions. Emergent actions on your behalf might be needed to save their life. Case study. At one of the adolescent psychiatric units that I worked on, we had both long-term and short-term clients. Those that were in the long-term were usually those that had committed a few crimes and were admitted for behavioral disorder modification, helping to change their behavior. They were usually with us for a few months. One of our patients showed a lot of the signs that were listed above. We decided to watch him closely for possible self-harm or a suicide attempt. We noticed that he started becoming more withdrawn, more aggressive, refused to go to the gym or outside for a recreational time. He started to refuse to shower or any personal hygiene. He began to smell bad. Hair became messy. He got in more fights, began sexually acting out towards the other boys on the floor. Eventually, we noticed that he had created a sharp edge from something that we will not describe here and began harming himself. On that day, when we found out that he had self-harmed, I asked the other staff to give me some time with him. After cleaning and dressing his wounds, we walked the empty hallway on the same floor that was not being used for patients. One of the other staff members stayed at one end of the hall for my safety to watch for any possible aggressive outbreaks. As we walked, this young man told me that he and his father had argued on the phone again, and that his dad did not want him to come home. His father had further stated that he did not trust him anymore, and said some incredibly hurtful things. This had been the trigger for him. Luckily, we were able to help him as a total health care team by increasing some of his meds while he increased therapy. When he got through the difficult part of therapy, his meds were decreased, as they are intended to be. We also spent more time with him, boosting his self-esteem and teaching him how to become stronger and more resilient. Some of the emotional resilience training was through teaching him about who he is as a human nature, and where some behaviors come from. The other aspect was behavioral techniques that helped him to shift his mindset. Both are what will be presented for the remaining portion of this book. Let's start by looking at some of the really cool stuff in the next chapter.